Hello everyone, my name is Madison Berry. I hope you enjoy learning about the topic of discussion I have prepared for you all. For my video presentation, I wanted to talk about child abuse and the long-term effects it has on children as they grow and develop. After doing some research, I found a few solid articles I'd like to share some information from. The first topic of discussion is single versus multi-type maltreatment, which examines the long-term effects of child abuse. In this study, there were 384 college students who completed measures of child abuse history, including neglect, emotional, physical, and sexual abuse. The few different effects identified amongst them were depression, suicidality, self-esteem, sexual behavior, drug and alcohol use, and delinquent behavior. Physical abuse has been shown to have long-term consequences on depressive behaviors. In a longitudinal study by Brown, Cohen, Johnson, and Smales, they found that children and adolescents who reported a history of abuse were more likely to exhibit a depressive disorder, as well as more past suicide attempts than the normal subjects. Lowered self-esteem has also been found to be associated with different types of abuse. Luce and Alexander examined the differential effects of childhood abuse and neglect. They found that neglect was a stronger predictor of loneliness, social isolation, and negative self-esteem than those who reported both neglect and abuse. Different types of abuse have also been found to be related to externalizing behaviors, such as substance abuse, delinquency, and promiscuity. Research indicates that exposure to childhood abuse is also related to subsequent delinquency and other externalizing behaviors, such as aggression. Evidence also suggests that victims of child sexual abuse are at risk for increased sexual activity. Ferguson et al. Found that individuals reporting sexual abuse histories were significantly more likely to engage in sexual risk-taking activities. An initial examination of the frequencies of individuals reporting different types of abuse was used to guide the decisions for classification. Very few individuals reported physical or sexual abuse without emotional abuse as well. In examining the frequencies of abuse when considering the possible combinations of neglect, physical, and sexual abuse, it was decided to use 6 groups, that being no abuse, neglect, emotional abuse, physical, and sexual abuse. Alright, moving on to the next article I found to be helpful for my research was the long-term effects of sexual abuse. The clinician in this article explains that she sees and treats individuals who suffer the effects of an abusive childhood. This includes their depression, inappropriate guilt about the abuse, their erosion of self-esteem, mistrust in relationships, and difficulty in enjoying their sexuality. University of Oregon psychologist Jennifer Freyd says that one of her patients, who is actually a successful businesswoman in her 50s, was discussing her memory of her father's first sexual advance towards her when she was a teenager. She explained that she realized that it was not just what he did to her physically that hurt her. She said at that moment, she felt like she lost her father and he was no longer a person to love and protect her. She felt that she was only there to satisfy him. She explained that it is terribly damaging to experience that kind of betrayal. Freyd also notes that such a situation forces children to hide their natural reactions because they are ambivalent, meaning they feel they must get along if that means putting up with sexual and physical exploitation. Furthermore, most trauma victims blame themselves inappropriately for situations over which they had no control. She explains that children do not understand independent causation. They understand what happens to them is a natural result of something they have done. Abusers who call what they are doing deserved punishment for real or imagined misdeeds reinforce this tendency. They then are not only damaged by the abuse, but feeling that they brought it upon themselves and deserved it. Okay, the third and final article I will be discussing information from is it possible to assess the impact of abuse on children who have pervasive developmental disorders? Children who have been the victims of physical violence, neglect, or sexual abuse frequently show signs of long-term disturbance. According to Hallen and Clements, studies indicate that between 30 and 50% of such children may fulfill the criteria for PTSD, post-traumatic stress disorder. As recognition of the impact of trauma on children generally has increased, so has awareness of the vulnerability of children with disabilities to sexual, physical, or emotional abuse. Not only may children with disabilities run a greater risk of abuse, but if it does occur, they are often unable to disclose its existence. This, combined with general lack of awareness of the symptoms of psychological trauma in children who cannot speak for themselves, may result in the abuse persisting for years before it is revealed. Even when abuse is discovered, the lack of effective treatment strategies is likely further to prolong their suffering. The strategy described in this article was to assess the long-term effects of abuse on a group of children who had attended a specialist autistic school where physical and emotional maltreatment of the children was well documented. They relied on parental reports due to the limited communication skills within the children. Despite the problems with using such data, it is possible to derive reliable measures that could be used to test hypotheses about predicted patterns of behavioral change based on work with other children who have been abused as well. In most cases, parental reports could be confirmed by information from other sources as well. It was revealed that consistent patterns in both the nature and timing of behavioral disturbances were found, which seemed to relate specifically to the period of abuse at the school. This on your screen is a table that revealed the numbers of children rated as having moderate to severe behavior problems over time. Thank you all for watching my presentation over the long-term effects of child abuse on children. I hope you have learned something or found something of interest to you throughout this video. On the last slide, I will have my references listed if you happen to be interested in anything that I have mentioned in this video.